quorum. We are going to call to order the August meeting of the Douglas County Board of Health. For the record, there is a copy of the Open Meetings Act on the north wall in the white folder. The official notice of publication has been sent out. With that, I will ask for a roll call.
Wade, Festerson, McNally,
Here.
Rogers,
Here.
Weiss, Jones, Wilkin, King, Espinoza.
Alrighty, let's go to item 2, which is approval of the minutes of the July meeting. Is there a motion to approve?
So moved.
Motion by McNally, is there a second? Second by Weiss. Roll call.
McNally,
Yes.
Rogers,
Yes.
Weiss, Wilkin,
Yes.
Espinoza. Abstain, okay.
Alrighty, we'll move on to item 3, which is approval of the action items. Please note for the record, item E, which may be listed on your agenda as agreement of DHHS regarding HPV vaccine, should be VFC vaccine. So with that change noted to the record, is there a motion to approve items 3A through I?
So moved.
Motion by Wilkin, is there a second? Second by Weiss. Roll call.
Okay. Wilkin,
Yes.
Rogers,
Yes.
Weiss, McNally,
Yes.
With that,
Espinoza.
oops, sorry.
Sorry, okay, we're good.
Good deal. With that, we'll go, I'm gonna give you time, Dr. Hughes, and go to presentations to get settled, unless you're ready now. Okay. Let's go to item 4 and presentations. And you doing the recognition? No, I'll wait then. We'll go to B. We'll go to B, which is the Community Health Nutrition and Clinical Service Division.
Oh,
You're up,
okay.
Lee.
Good morning, board.
Morning.
All right, let me make sure I actually share on the Zoom, because I have done that before. All right. So I'm here to give an update on our Community Health Nutrition and Clinic Services Division. Just a reminder as to what programs are within my division. We have the STI Immunization Clinic, which includes STI services, adult and childhood immunizations, COVID-19 vaccines. Then we have our STI Prevention and Control Program, which does surveillance and then outreach, education, and testing. We also have our Women, Infant, and Children clinics, which includes nutrition education, breastfeeding support, referrals, healthy foods, and formula. And then in our health promotion section, we have tobacco prevention, fetal infant mortality review, baby blossoms, community health workers, and our overdose prevention. So within our immunization clinic, some updates are that our influenza vaccines we're no longer going to be providing because there was some funding changes to DHHS. So we were fortunate the last few years to be able to provide flu vaccines because they offered it to us for free and we could give that out to the community. Fortunately, we don't have that funding anymore. So with COVID vaccines, we are really focusing on our under and uninsured. Same kind of falls into our routine immunizations for adults, is that under and uninsured population. So we're no longer doing the community COVID vaccines like we were the last 3 years or so. And then for Mpox vaccine, we did about 32 doses in Q4, which was double the number of the doses provided in Q3. Some accomplishments, challenges. So with the change in funding, as I mentioned with COVID, it doesn't allow us to provide the free vaccines for all. And our continued funding, we did get some additional funds to provide COVID vaccines for the under and uninsured through December of 2024, which allows us to do some outreach vaccination clinics. So we're really going to be ramping that up here in the next month, starting to kind of really go with the flu and COVID season, if you will. And then for future immunization, just a heads up that our Vaccine for Adult program that comes through the state is going to be including COVID, Mpox, and all other routine immunizations for adults. So all of that funding is going to have to cover all of those vaccines in the future. So just some of the challenges that we're kind of foreseeing as we move into the future. A quick syphilis update. So we have and I can't remember if I showed off the dashboard the last time, but we now have a syphilis dashboard up on our website. The Q2 data is being cleaned up currently, so we'll be posting that hopefully in the next week or two. I'm trying to remember the date, about a month and a half ago, we had a press conference that talked about the rising number in syphilis. And then along with that press conference, we talked about Washington University provided some CEUs a week long, so all providers could sign up. It was pretty much over the lunch hour. There was a great turnout from it, and I can get those numbers later for you all on that. We also had our staff go out and do some provider notification and really share the press release that went along with the press conference, sharing the information that we discussed, treatment, if there's questions about testing. And so they visited 36 clinics, which was great. I know the providers there really enjoyed having someone come and talk to them about syphilis and kind of the new recommendations that we're putting out as in regards to pregnant women. We've also started DoxyPep in our clinical setting. And then we are also going to be receiving some combo HIV syphilis point of care testing for our outreach. So we're excited to have that because we've always had HIV tests to provide out in the field, but now we're going to be adding even more syphilis testing when we're doing outreach settings. Some other STI updates, our at-home testing program. We had 9 individuals tested so far this year. It's been a limited program just because we've had limited staffing, but of those 9 individuals, 22% were positive. We've done some great collaboration with SARPI-CAS, 3 Rivers, Lincoln Lancaster, and 4 Rivers to really talk about a media campaign focusing on chlamydia at this point, but for the funding, that's what we're getting with it, and we're excited. We're also going to be piloting with 3 Rivers and Lincoln along with our at-home testing to validate some testing swabs. We've also implemented a social determinants of health screener within our clinic, and so our community health workers from our health promotion program are actually in our clinic. And since that referral program started, we've had 136 client referrals from clinic, and that was starting in April. So I think the last time I was here, I was so excited to tell you we did receive Sherwood funding. And so we are going to be having some new staff hired on. We have a new clinic clerk that we hired. Gabriella started yesterday. We have a STI HIV prevention specialist position that is posted, as well as an STI immunization clinic coordinator that is currently posted. One of the most exciting things about the Sherwood funding is we are going to have outdoor vending machines. It was one of the things I had really envisioned for the department, and like, if we're short-staffed, how can I have services available to our community, but also be limited with staffing? So these machines, we're going to be getting 5 of them. They will be outdoor. They can handle the temperature and weather. They're going to have STI test kits, wound care kits, COVID test kits, condoms and lube. There's going to be all kinds of things that we can put in them. So I'm very excited and looking forward to kind of telling you guys more about our outdoor vending machines. But Connie is currently working on kind of coming up with what they're going to look like. This is just from the manufacturer, kind of the sample, but it's very exciting, and I cannot wait to get this going. So we also have our REACH grant that within my division, we are partnering with the Division of Health Equity and Planning. So we have completed the NEMS assessment. So data collection is done. The report will be available in the fall, here probably in the next month or so. And then we're also talking about doing a part 2, which is the NEMS perceptions. That one will actually do a little bit more involvement with community members to find out their perceptions on what healthy foods are actually available in their community. So we have partnered with Sarpy-Cass and Pottawatomie County on completing NEMS within our region. Another pillar, if you will, of the REACH grant is the breastfeeding data collection. We've done an environmental scan of breastfeeding classes and information in Douglas County, as well as pulling together breastfeeding data and also looking at our vital records data. And the other two pieces would be our immunization data and then our vaccine hesitancy data that's come through. So we're sharing all of that with the Creighton REACH program. Within our health promotion program, we have our overdose prevention. So we will be starting our year 2 of our OD2A funding, which starts September 1. There was carryover approval of year 1 funds, which was very thankful for because we had a slow time getting it going. But our year 2 work plan is going to be starting, and some of the things that we've done so far, we have a new educator, I guess she's new-ish, but she has provided 88 individuals with naloxone education. And then we have had our overdose fatality review team has met twice to review cases so far. Our community health worker program, so we have our new LINs that many of you heard Jordan talk about a couple months ago, I believe. But the North and South summer program have been completed, and we are also going to be doing, I think, a fall program here. We've never done a fall program before, so we're excited. We're testing out some new things. We've got our diabetes prevention program, so 2 of our community health workers have done 2 rounds of this education. They don't do as much in the summer just because it's harder to coordinate the courses, but they've done them in Burmese and Karen. Then with our navigation, as I mentioned, there was 136 just from our clinic alone, but we've had 316 clients outside of our clinic that have been through our community health worker navigation. Some really exciting news with our Femur and Baby Blossoms Collaborative. We do have a nurse. She was brought on, and we are excited to have her and to get the work started. We are starting a strategic plan for our Baby Blossom Collaborative. It's going to be a little bit of a process just to kind of find out what the next steps are, but we really want to come to Baby Blossoms with a coordinated effort with some of our partners. So we thought that a strategic plan would be the best way to go about that. And then also just gathering data. I believe we've gathered the data we needed from DHHS for vital records to update our PPOR data as well. And then lastly for WIC, just a couple things. I don't want to say too much because Cassandra is here and she will be presenting more on WIC. Just 50-year anniversary, and then like I mentioned, capacity, we're looking at adding another dietitian, and then locations, we're still trying to figure out a new
Please,
spot.
just real quick, would somebody explain what MPRO is, just for the acronym piece?
Midwest Mountain Plains Regional Office.
Okay.
I knew I'd screw that up. And then this, oh, and of course it didn't come up right. That red line is supposed to go through the Creighton community one. But this was a slide from my last presentation in February, but there's some changes to it because I wanted to show the things that we've accomplished so far with our kind of annual division goals that I wanted. So with funding, STI funding, check, we did receive. Overdose we've had, and then our food insecurity assessment, we were able to receive funding through REACH to complete the NEMS assessment. So all the funding goals that I had, we've been able to accomplish. The infant health work, we're slowly moving towards that now that we have a nurse hired. So I'm hopeful that in the next time I'll be able to show you many more check marks now that we have a nurse started and can really get moving on our maternal child health work. And then collaboration between programs, I think that's been evident. We've had community health workers involved, and my teams have been working very well together and coordinating kind of the efforts they're doing in outreach settings. The grants received, as mentioned, we've had our OD2A local grant from CDC that was $890,000 per year for 5 years. We've had our REACH contract that was finalized. Our Creighton community grant has ended, but then we also have our Sherwood Foundation that was over $4 million for 5 years. So, like I said, the upcoming application we completed, received. We are health literacy champions, and we did finalize a screener for our referral program for the CHWs. So I'm very excited. We've done some really great things so far in our division. And now if there's any questions, if not, Cassandra, I believe, if we want to go that route, but
Questions? I do.
Okay.
Tell me, so so you got the food assessment and you got the new social determinant of health assessment. I guess one on the social determinant of health assessment, is this similar to the one that the hospitals are required to do now? Or is this your own?
It's our own, but we've looked at several other, so the NALID group with the equity, I can't remember the name of the actual grant for it, but we've been coordinating with the ones that the hospitals do. So they all are very similar in asking questions, but we mimicked it off of that, but also catered it to our population, so.
At some point, I guess, all of you all got these assessments. I guess particularly with your food assessment and the social determinant of health assessment, I'm just curious, how is it all coordinating together? Like, is it like warm handoffs at the end?
So the
How is it
food
timed?
assessment one is different. It's called NEMS, so it's the Nutrition Environment Measure Survey. That's where we go out. So we've had staff go out and look at all the grocery and convenience stores within Douglas County
Okay,
and determine what healthy foods are available. So our team, Jamin and I's staff both went out, and we had over 500 stores that they assessed. So a ton of work went into this and getting it done. We've done this assessment twice before, 2015 and 2018. So we were excited to get it going again. But once that piece is done, then you kind of look at the next steps and find out how can we increase and promote healthy foods in those areas. And I'm also wanting to do that perception secondary. As for the screener, we do warm handoffs. So we've got our community health workers are navigating based on that social determinants of health screener.
okay. That's the connect.
Yeah.
So I'm assuming the community health workers are able to go back and forth on, I'm assuming with the community health workers, if they come in contact with somebody, would they give this assessment to somebody?
I believe they do.
Okay.
I don't want to say 100%, but I'm almost certain that they do.
Okay. Okay, thanks.
Yeah.
All right,
Do
appreciate
you
it.
want Wick to go next, or do
Yes.
you want? Okay.
Good morning, I'm Cassandra. I'm the Douglas County WIC Supervisor. I will be sharing some updates of things that are going on in our program over the last few months. So I thought it was very apropos that I was asked to speak this month. August is National Breastfeeding Month.
Cassandra, you want to speak into that mic a little deeper?
Yeah, let me get closer. I'm sorry, I know I don't speak very loudly.
Nope, you're all right.
With National Breastfeeding Month being in August, in WIC we always try to do something or things to kind of bring attention to the work that we do in this area. So one thing, we applied for the Douglas County Health Department to receive the Breastfeeding Friendly Business Award. And this is awarded to by the Nebraska Breastfeeding Coalition to workplaces that show support to breastfeeding patrons and employees. So we were awarded that earlier this month. And the qualifications for that are things that we've been doing and had in place, but this is just kind of making that official and something we can share with the community. And then also earlier this month, our WIC program received the Gold Breastfeeding Award of Excellence, and this is awarded by the Food and Nutrition Services Administration of the USDA, which is over the WIC programs. And it's awarded to agencies who demonstrate excellence in breastfeeding practices and support, which includes having breastfeeding peer counselor program. And this is a picture of me and Deanna, who's our breastfeeding program coordinator, and our state breastfeeding program coordinator and one of the other state staff who were kind enough to come into town and present us with this award in person. We were the only local agency WIC program in the state to get this award this year. Also, 2024 marks the 50th anniversary of the WIC program. The first WIC clinic opened in 1974. I believe the first WIC clinic in Nebraska was actually opened in Omaha in 1975, but now WIC is in all 50 states, all U.S. territories, and several military installations overseas. So to celebrate the 50th anniversary as well as the years of service and dedication that our staff have given to the WIC program, we decided to do a kind of an all-staff meeting celebration. So we hosted that at the Yates Illuminates building, and all of the local agency WIC staff from Douglas and Sarpy County were invited to that. We had Omaha Integrative Care come and do some training and had some fun activities for the staff, and then they were able to share kind of their WIC stories with each other, how long they've worked for the WIC program and kind of why they work for the WIC program, and stories from their years of experience. So that was kind of nice. In our agency, we have people who at that time had worked for WIC for as little as 3 months all the way up to almost 30 years. So and then we took some pictures. We had kind of a photo booth. Connie was kind enough to make us this cute WIC picture frame and some fun photo props and posters that we put up in the room. So this is staff from across the agency at all the offices.
Can I stop you for 1 minute?
Yeah.
I'm just trying to see, your slides aren't moving on the, I see them there, but I don't see them moving on the Zoom.
Oh,
So I don't know what's going on.
I don't know what.
Yeah, okay. There we go. All right. You good?
Sorry about that. Okay, so I can go back into previous slides, but for now, I'll keep moving forward. So yeah, this is some of our staff pictures that they took together. It was kind of nice for them some of them, have worked together for many years, and, maybe only get to catch up with each other once or twice a year when we meet in person. So it's kind of a fun time. Okay, so moving on to numbers. So far this year, our participation, average monthly participation for our agency is 14,282, compared to last year, which was, the average was 14,940. So we're a little bit below that, which we kind of knew would happen. Basically, we had physical presence waivers in place most of the year last year due to COVID, and those ended at the end of the year. So we expected there to be kind of a decline in participation, which there was for about 6 months, and then now the last 6 months it's starting to kind of trend upward a little bit. Our highest participation month so far this year was 14,701, compared to last year was 15,582. And then that number is pretty much our target enrollment for the next fiscal year. So some of the things we've been doing to try to reach this goal for outreach, we've had staff go to the Together Food Pantry 1 day a month at the end of the month to get people enrolled that are eligible and maybe not on the program, or get people scheduled for another appointment if they've maybe fallen off. We went out to the Sarpy County Early Head Start Enrollment Day, and we were able to get some kids and families signed up there, or again, get them scheduled if they'd missed an appointment or just needed benefits. Also kind of working on doing some similar outreach efforts with Educare North and South. Last year we went to all the metro area birthing hospitals and provided outreach materials and talked to the social workers there and just made sure they had updated information and they were referring any potentially eligible women and babies. I've also talked to all the Medicaid health insurance providers to make sure they have all of our information and answered any questions. this fall, we're going to be focusing on going out to the OBGYN offices, again, bringing our information and making sure that they are referring as well to any potentially eligible pregnant people. Funding this year for our Nutrition Services Administration was $3,887,523. $495,000 of that went to a subaward to Charles Drew to provide WIC client services. $890,000 went to One World to provide WIC client services there, and then $40,000 went to Nebraska Medicine to provide WIC client services at the Olson Center. And then breastfeeding peer counselor funding is a separate pot of money. So that this year we received $141,602. $88,500 went to the Sarpy-Cass Health Department for, they hire and kind of provide administrative oversight of the breastfeeding peer counselors. And then the remainder goes to our breastfeeding program coordinator who does the training and kind of day-to-day workload oversight of the breastfeeding peer counselors. This summer, our vendor manager, Laura, has been very busy with the vendor reauthorization. So this process, basically, it's required every 3 years for vendors to stay as a WIC-approved grocery store or pharmacy. So she's had 67 grocery stores and 26 pharmacies in Douglas and Sarpy County that she has been working to get reauthorized. So this involves collecting applications from each of the vendors, completing an on-site inspection, so she has to go out and make sure they're meeting minimum inventory of WIC items, as well as just making sure they're following all the rules and requirements to be a WIC vendor, and then getting all the vendors signed up for a required vendor agreement training. So kind of started last spring. It's about a 6-month process, and then it'll be wrapped up by the end of this fiscal year. So the end of September, all of those vendors have to complete that vendor agreement training. And then we do plan to develop a map of the WIC-approved grocery stores in our area that can be used for our purposes as well as for other department projects, so like the REACH grant and things like that come up. Okay, and then you may have heard about the WIC online shopping. That's fairly new. It just started in May. So WIC participants can now order their WIC groceries online at participating Hy-Vee stores. So Nebraska WIC, in partnership with Minnesota and Iowa, are piloting this program. They received a grant to do this. Over COVID, there was just a big push to make this a possibility. So in Nebraska, it was piloted in Lincoln starting in March, and then in May rolled out to Omaha and the rest of Nebraska. As of mid-July, there had been $100,000 spent so far in Nebraska on WIC online orders, so it's been really successful. I'm sure it's much higher than that now, and we've received a lot of positive feedback from WIC participants that this has been a great thing to add. So if you've been to our webpage recently or in the clinics, this is the flyer they were advertising. So participants who are interested can just ask about it, and then WIC staff will help kind of get them started and show them how to get on and start being able to order their groceries online. They do also have the option to pay, I think it's $10 to have their groceries delivered even if they want to do that, but the store pickup is free. Okay, and then WIC we seem to constantly be changing, although the overall mission and goals of the WIC program has really remained the same over the last 50 years. They're just, especially right now, seems to be a lot of effort put into modernizing things. So the online ordering is a great example of that. And then just a couple of other things that we have coming up. In the next few months, we'll start offering video conferencing for our nutrition education appointments. So right now, a lot of those can be done over the phone, but this would just add that kind of telehealth feel where we can actually see the participant and they can see the nutritionist that they're talking to and kind of have eyes on and a more personable one-on-one feel for those appointments. Sorry. if they're able and want to do that. And then also there will be at some point, a WIC portal. So participants will be able to submit proofs and different things that they need ahead of their appointment. So to kind of streamline that enrollment and certification process, they can upload documents. We can also provide, if it's an education pamphlet or maybe like a referral resource that they need, we can upload those and they can access them through the portal as well. And that is all I have for you today.
Any questions? Okay. I'm just curious, your video conferencing, how are you doing that? You doing it like FaceTime, or you sending them a link, or how are you doing
So it'll be Zoom, and it's actually a state, we let's see, I think it is a day in October. So we still have yet to have the training on it. But it'll be over Zoom, and I'm not sure exactly the details of how it will work yet. But
Do you have to use I know there's a healthcare version of Zoom that's kind of private. Do you have to do any of that since you're like?
I would assume so.
Okay.
Again, I mean, the state's kind of, they're kind of spearheading that, and then it'll be up to us to implement that in our clinics, but I don't have the details on that yet. I would assume it'd have to be that kind of version.
Okay. All right. What is I'm just curious, how did you all get to using the Yates building as the congregating spot for both counties?
Well, we usually, like, once or twice a year, we host an all-staff meeting somewhere, and we just chose that building. We've had other health department meetings out there, and it was a nice space.
No, I'm just curious. I haven't seen it since it's got there, but I'm just curious how you got there. No coincidence, just coincidence.
Yeah.
Really?
It's all of us, surprisingly.
Yeah.
It's been a really nice thing to have that available.
Mm-hmm. Okay. Just wondering. Okay. Thank you.
Yeah. Thank you.
All right. Dr. Hughes, I'm gonna turn it back over to you for presentations and A, and then you can just go into your report.
I have to make 2 trips today. Okay, good morning.
Morning.
And thank you for your flexibility with our agenda today. We appreciate that. I have a few updates that I am going to do quickly, and then we have a recognition that we would like to do. For our Douglas County Health Department updates for August, my first one was going to be that Douglas County Health Department's WIC office was awarded the Mountain Plains Region's 2024 Breastfeeding Award for Excellence, because I was so excited about that. It's a really, really wonderful thing. We love fed babies, but the fact that we are able to really promote breastfeeding in a successful way for our participants and for our community at large, I think is a really big deal, and I'm thrilled to see that we are doing great work in that arena and being recognized for it. So congratulations to our WIC clinic for their hard work there. Just a couple of just very brief building updates. We're continuing work on updating our building and security system. The parking lot, the east parking lot, which I think I talked to you about a couple of months ago, I think is, there's a plan and it's being worked on. So hopefully we're going to have a better parking lot for our employees, hopefully soon. We are also working toward expanding our conference room. So you guys know this conference room all too well because you were squished in there for a really long time for Board of Health meetings. That room really is not conducive to bringing community partners in and having meetings, which kind of was evident a couple of weeks ago. We hosted an EPA community grants listening session, and We were in danger of having to actually turn community partners away because of the size of that room. We lucked out that some people who had signed up didn't come, and so we didn't have to turn people away from that. But you know, if everyone had showed up who had registered, we could have been in that place. And so, you know, we're looking at this room. Oftentimes, our audiovisual system isn't working appropriately. It's hard to see, it's hard to hear, it's just not a great setup. And so we are working with Public Properties to actually knock out some walls, hopefully, and actually expand that room and make it a bit bigger, which will enable us to bring more community meetings on site. Certainly the bigger ones, we're still going to have to look to find an alternate facility for that, but hopefully, you know, some of the smaller ones will be able to actually host. I think that's a really important task for a health department to be able to do, because convening and facilitating is one of our superpowers, and unfortunately, right now we really have to kind of beg room in other places in order to do that. So we are working towards that, and we will keep you updated on that. And then, like I said, we had hosted an EPA listening session for some community partners in that room, and I will say that it was actually pretty positive. We had some wonderful partners in the room, and specifically that listening session was for a community change grant that the EPA has put out, and it's kind of a really big deal because we've never really seen them put out this type of grant before. And at this size, I believe it's $40 million, and is really meant to give funding to different organizations within a community to work together to change infrastructure or programs within the community that will better support environmental justice for our communities. And my understanding is nobody in our region has been awarded this yet. And so there's kind of a big push to get someone in Omaha, organizations within Omaha to apply for these fundings so that we can take advantage of that. So there are conversations happening right now with community partners around that grant, and I will happily update you in the future if we do choose to apply for this grant, but I think it could be a very positive thing, and I'm glad that we were able to host that listening session. I also want to remind you that we are bringing on a new Chief of Environmental Health Services, and that individual, Eric Bradley, will be starting on September 3rd. So that's coming up. We're super excited, and I'm hoping that I will get to introduce him to you at our next board meeting. I also wanted to update you that strategic planning, I should call it pre-planning, is continuing. So we are getting a contract in place for the facilitation of our strategic plan, and all of you will be invited to participate in that process. We're hoping to start that process here coming up in September, so please watch your emails. We'll be reaching out to you with dates and kind of the format for what we'll be doing there, and I'm very excited to just kind of put together a concise and actionable plan for us moving forward. I believe you may have also seen a matrix come out that kind of detailed the successes and progress that we had in our old strategic plan. If not, keep your eyes open for that, or go back and check. I think it was emailed out. And so it's pretty extensive because that strategic plan was gigantic and had a lot in it. And so you might have to do a little bit of scrolling, but it does highlight the progress that we were able to make on that strategic plan, which was developed before COVID. So we had quite a bit happening in there that probably precluded some of that work from being completed, but I'm actually pretty proud of how far the department did move, even with that kind of big several years long event that was occurring. The community health assessment that is typically facilitated through the Wellbeing Partners we've kind of gone through that data collection period with PRC, and so I anticipate that here in a month or two we'll be able to bring the Wellbeing Partners or PRC here to give you an update on the data that we see with that. And so that's another thing that you can stay tuned for. Quick accreditation update. We continue to successfully move forward toward becoming accredited, which is very exciting. So we had some documentation questions that had come back to us. This is a very normal part of this accreditation process. It's kind of a pre-site visit review, if you will, and they did ask for a number of different updates regarding that, and we were able to submit all of our answers for that a day early. So again, we're really being able to keep on top of that with our great accreditation coordinator and our awesome domain teams that are really jumping in every time we're asking them to do so. We're really proud of that. And so the next step is that we are waiting to hear when they're going to actually be boots on the ground and visiting us at Douglas County Health Department. So we'll keep you updated on that. I also would anticipate that the site visitors may have some questions that they would like to pose to members of the Board of Health. Those could be virtual or in person. So if you would just kind of watch your emails for invitations regarding that. And of course, you know, if you need some flexibility, we'll work with you on getting those scheduled. But that should be coming up here, I would anticipate, fairly soon in the next couple of months. One update I wanted to do kind of quickly is just, hey guys, it's August and school has just started back in session. And you know what that means. We have respiratory illnesses that are circulating already. Lots of different kinds of illnesses are already, I think, making themselves apparent in our school kids. My own daughter's been home for several days with something that looks like strep, but isn't strep. And so it's just a good reminder that we want to make sure that we're doing the things that we need to do to keep our community healthy. So great hand washing is one of those really important things. Staying home when we're sick, not being out spreading illness if we have illness, and even wearing masks if the situation warrants that. So if you are high risk, if you're going to be in crowded areas, this is a good time that you may want to be taking additional precautions. On that end, I wanted to go ahead and just show you the dashboard and remind everybody that the dashboard is there. Give me just a second here to pull that up. All right, so here we've got our Douglas County Respiratory Illnesses dashboard, and this you can access right through our Douglas County Health Department main site. It's pretty easy to get to, and we have a number of different components to this portal here. So COVID is one we're getting lots of questions on right now, so I'm going to go ahead and just pop in here. And you can see here that our numbers are a little higher than they have been over the summer, which isn't too surprising. Now, this timeline down here is pretty long. You can actually see multiple years down there, which doesn't always necessarily give you the right picture of what's happening right now. So we're just going to zoom in just a little bit by dragging this, this over. And now you can get a better picture over here. To the right, you can see that increase that's been happening with our COVID-19 numbers. This next tab just gives you a little bit more information on testing. So you can see that COVID tests that are performed, you can see these over multiple years. And then you can see that our percent positive, which is this bottom left one, this is just PCR. So obviously this doesn't include those home tests, those quick home tests that you can do. These are the actual PCR tests that take a day or two to come back. And you can see this darker line is us in 2024. So you can see that while we may not have a ton more tests that are happening, the ones that are happening are coming back positive pretty frequently. So that tells us that we have some illness going on out there in the community. This is by age group. I'm not going to get into that today. By sex, not going to get into that today. So what I do want to go over to is just looking at some of these other pieces of data. This is kind of a good summary of who and where our COVID cases are occurring. And then we've got respiratory cases by month. And again, just for those who don't remember, you can use these little sliders so that you're able to zoom in just a little bit. But one of the components that I really wanted to be able to show you, if I'm able to get over to it, and I've got things that are over my bar here, is hospitalizations. So hospitalizations is one that we're always really wanting to just keep a little bit of an eye on so that we know what's happening there. And again, it's good to zoom in so you can see the current situation a little more clearly, and you're not, if you want to see trends over years, that's fantastic, but I'm interested in just kind of giving you a current update. So you actually are looking on this metro hospitals and people on ventilators. You're actually wanting to look at the yellow line because that's COVID-19 patients on ventilators, and you can see that we don't actually have any COVID-19 patients who are on ventilators right now, which is, of course, wonderful. We want to see that. And you can see from April through now, we've kind of had an up and down trend line, but perhaps getting maybe a couple more patients that are in the hospital with that. And then our capacity in terms of beds, this is kind of a nice visual because this gray that you see is really kind of the gap between how many people are hospitalized and how many beds you have left. So we can see that we have a bit of a gap there. Let's see, let's call it 400 beds that are available. And that's 2023, so hopefully we'll get that updated. But right now things are looking basically okay from a hospitalization standpoint, but we do know there is some more circulating in the community. And I would expect that we probably are going to see even more now that school's back in session. So again, just taking those precautions in terms of staying home, keeping your kiddos home when they're sick, and things like that can prevent the spread of illness within our community. So that is an extremely fast update, and if you would like a more in-depth COVID update, we can certainly look at doing that. COVID vaccines, we are expecting here in the next month or two. So as soon as the new booster is approved, that will come out, and that will be available in the community. I think we're eyeballing about mid to late September for that. So we'll keep our eye on that, and of course we'll put more information out to the public as we have it on the availability of that COVID-19 vaccine. I feel like I just talked really, really fast. Another development that we have had in Douglas County, and I think you may have even seen some of the information that came out about this. We did have a new vector-borne infectious disease that was identified in our mosquito populations. It's called the Jamestown, am I right? Is it Jamestown Canyon virus? Thank you. This is similar, what's that?
Canyon.
Okay.
Jamestown Canyon virus. Interestingly, it was first found in Colorado in Jamestown Canyon, which I passed every day for 5 years. But that is where this particular vector-borne disease was first identified. It has never been identified in Nebraska until just recently. It was found in one of our mosquito pools that we do testing on up at Cunningham. And so this particular illness looks a lot like some of the others, such as West Nile virus. So typically people who contract this illness may have some pretty nasty influenza-like symptoms, so achy, feeling very fatigued and under the weather, fever, these sorts of things for a couple of days. It can last for some time for some people, but most people who contract it aren't even going to get symptoms, which is very similar to how West Nile virus operates. So we just want people to know it's out there. We haven't had any people test positive for Jamestown Canyon virus. Again, this has just been in the mosquito population, but we do know that it's now here. So we just want our people and our physicians to be aware. There was a HAN that went out to our physicians about Jamestown Canyon virus, so they're all aware what they can do in terms of testing if they have a high suspicion for that. So it's been kind of an exciting month, I guess you could say, for our epidemiology people in terms of kind of seeing some new things. That is all I have in terms of director updates. Do any of you have any questions so far on all of that?
Dr. Hughes,
Mhm.
on that slide about hospitalizations,
Yes.
did I read correctly that it said they're no longer required to report COVID cases as of May?
So let's pop into that and see the pop up. So hospitals are no longer required to report hospital respiratory pathogens, the bed capacity and things like that. That could change if we saw extraordinarily high numbers again, the way we had before coming into the hospital. But at this time, they're not required to report that.
So how do we get the data about people who are hospitalized with COVID? Who do they, if they're not required to report it?
The ones who do report it, we would get, but we don't, if they're not reporting it, we're not seeing it.
Huh.
Yeah.
And how did that decision come about in May? I mean, what agency, entity made that decision?
That's a great question, and I don't know if I can answer it. Do you know, Justin? Since Justin's people kind of oversee a lot of that, they know specifics.
Yeah, so with the end of the pandemic, the state no longer requires those hospitalization numbers to be reported. So we're no longer reporting them on the dashboard, but I made the decision to leave that there for kind of historical reasons, so that if folks wanted to go back and compare what happened previously. However, we are still receiving some data from the CDC. If you can go to the CDC website, and they do have some hospitalization data. And in the last week, there's been a moderate increase in the state of Nebraska in hospitalizations. But they don't report bed occupancy, number of people on ventilators, things like that. It's just total number of people hospitalized due to COVID infection.
Is that indicative of most states that they're no longer getting that data?
I would say it probably varies across the country. Yeah, but we are seeing over half of the country right now is seeing high levels of COVID virus in wastewater, which coincides with what we're seeing in illness right now. Yeah.
Okay, thank you.
And I apologize, I didn't get all the way over to the wastewater tab on here. It pops up a little differently here than it does on my desktop. Any other questions?
I just wanted to pay a compliment to you and to staff. I saw that this week we officially have declared that the rabies case we were concerned about is closed and has not spread, and that was quite the mobilization at the time of resources throughout the community to make sure that didn't happen, and I would consider that a public health success. So
Thank you.
Thanks for that work.
Yes, absolutely. We were able to close that out. So just a very quick recap. We had no raccoon rabies found in any of our additional testing that has been occurring since the very first case that we found in that kitten. And so we can pretty confidently say that we did not have any spread from that case to other animals or people, thank goodness, in our community. And yes, it was quite the event. There were a lot of partners that came together to make that happen. Certainly, DHHS, the USDA. We had a number. Or I apologize, not USDA. Help me out here. My brain is just. Oh, USDA. I wasn't crazy. Nebraska Humane Society. Just there were a number of partners that had to come together to really make that successful. And it really was just a beautiful example of how well public health works when people come together with a shared goal and really don't care about who gets the credit for it. Just everybody comes together and does what they specialize in doing to get the work done. It was a really great example. So thank you for that. Thank you.
Anybody else? Okay.
All right, so I believe after this, we have a recognition. And I apologize,
Hughes.
did she have to leave? She had a patient at 9:30, which we didn't know.
Okay. Can I ask you, so you did the V2R update?
I
All
did
in
not do the V2R. I need to do that, thank you.
Okay.
Since Shannon had to leave, I feel a little better about doing the V2R. I was really trying to get to her, knowing that she might have some patients. So I will just mention that we wanted to recognize Shannon Stafford, who was here for most of the meeting. She is one of our nurse practitioners in the clinic, and she's been here for 15 years. And honestly, when I think about nurse, and if I had to kind of have a picture in the dictionary that defines nurse, Shannon's picture probably would be there. She just has an incredibly compassionate and just wonderful way of not only taking care of her patients, but also caring for the people around her, whether that's her coworkers, her leaders. She is a huge, wonderful presence for us to have at Douglas County Health Department, and we're very proud of her, and I hope we get to keep her for 15 more years, to be perfectly honest. So I am sorry that we did not get to present her certificate to her while she was here, but I still want to shout out to her and honor her for the time that she's given us. And that said, I will move back into our V2R. So V2R is the vision to reality. So this is that pre-work that we're doing ahead of strategic planning to really make sure that the whole department is moving in the same direction in terms of what is our purpose, who are we, how do we agree to make the journey toward our goals together. And that really comes down to what are our core values. So last month I talked to you just a little bit about something called the BHAG, which is our big, hairy, audacious goal, which is to be the healthiest metro community in the Midwest by 2040. We are very thoughtfully working on how to define that and really putting in place some actionable metrics so that we can prove our claim when we get there that we are the healthiest metro in the community, or healthiest metro in the Midwest. And so as it's going to take us a few months because we want to be very intentional about those metrics, but I will definitely be presenting those to you and to the community when we get there. This month, however, so each month we're focusing on a different component of V2R, and this month we are focusing on our first core value, which I think is one of our
That was happening yesterday too. Hopefully I'll come back on here. Mhm. We're nothing if not flexible, right?
So as we've had conversations around People First in the department, it's really interesting to see kind of all of the different ideas and thoughts that have come up around, well, what does that actually mean? For some, that's really been a focus on our internal environment, so how we're taking care of employees. Others are very focused on kind of everything outside of our walls and how we're serving our community. But for me, I really think that it's both. And so when I thought about People First, I kind of had a visual in my head of somebody who is out on a tightrope with one of those bars to keep their balance as they're walking across. And I want to just say that this is not a scary tightrope walk. This is a really, really exciting tightrope walk to get to serve not just our employees, but also our 600,000 people who live in our communities. And so I kind of put the visual down on paper so I can share it with staff and they kind of understand where I'm coming from with this. So what we see here is, as leaders in Douglas County Health Department, our employees need certain things in order to have well-being and to be able to function well. And that is something that we as leaders really have to be intentional to focus on. So things like schedule flexibility, work style flexibility, taking into account some of those personal needs. We need to empower our staff and show trust in our staff. These are all important things that help with well-being. And this is by no means an exhaustive list. This is just a few things that came to mind. And then we have to balance those with accountability to the public, consistent and excellent service to the people who need us, listening to those community needs. So hearing our community and not always just assuming that we know what's best, right? Assuring good stewardship of the resources that we have, and then follow through with partners. And sometimes, you look at things like schedule flexibility and accountability to the public. Sometimes there's a tension there that we have to maintain and really strike a good balance. And so for me, it's not either or. It's really a yes and situation where we're really learning how to keep that balance in a way that we're not falling off that tightrope that we're walking, and really helping our staff to also see how that balance is achieved and how they can balance that too. So for me, that is really like the integral piece of People First, is that we're being very mindful kind of in two different directions, where we're helping staff to be resilient and healthy in their work, but we're also doing everything that we can to excellently serve the people in our community. So again, we are, our chiefs, our supervisors are all having conversations with our employees about what People First means to them. We're kind of hearing that and bringing it back in our management meetings and talking about it so that we can be very intentional and really do things that will be helpful, I think, for both staff and our community. One of the examples of this is I just wrote our inclement weather policy. Actually, we call it the inclement weather and building closure policy. So one of the sticky situations we've had a few times over the past few years is where we've had significant weather events or something has happened in the building that has required us to close the building and send people home. This has been a really tough situation for us at times because we have some people who could work from home, and then we have people who really don't have that option. They're clinical staff, so typically, they're seeing patients. They're not sitting at home doing program planning or implementation or things like that, and so it's a lot harder for them to work at home. And so you get kind of this inequity that's happening with what you're able to do with staff when you have that. Not to mention, if something happens in the building and you have to close everything down, now those services are not as available to staff. And so this policy is currently under review with our management staff and our policy work group. And it's really meant to lay out some specifics and build a structure that will allow for better working remotely for people, even if they are clinical staff. So that requires us to have things like a really robust training platform so that if they, if our nurses are having to, if I have to send everybody home for the day, the nurses can work on their continuing education credits, or they can, we may have a large training bank of public health focused trainings that people are able to work through if they are having to be at home. And so that there isn't kind of this, this inequity where some people can work from home, but some other people might have to take leave if we would do something like that. So to me, that's an example of, how we're kind of trying to really be very intentional in our policies and our practices and our decision making to strike that balance between taking good care of our staff and being concerned about their safety and their well-being, but also making sure we have things that are available for our community. So that's People First. Next month will be Belonging, which I think is going to be a really great conversation. So more to come on that, along with some more information on strategic planning.
Thank you, Dr. Hughes. Let me just, under your report, I'm going to include it under here because it kind of happened, but I just want to mention to everybody so they're aware. For a few of you all are aware here, but if you were not aware of the results of Nebraska special session, and one of those results was a bill called LB 34 that got passed. One of the clauses in that bill was a point of reference geared at local authority, particularly cities and counties, in regards to the amount of levying authority that they had. The language specifically says something like you're able to grow at 0 to whatever the percentage of a particular index, which was called a governmental index. And I forgot the name of it specifically. From my understanding on range, that index has had years where it's been 0 and it's had years where it's been up as high as 5%. The issue with that is on years that something like that may go 0, that means your budget has no growth, and in some extent you pretty much lose ground. So the restriction is on everything except what's considered public safety, which is a broad view here for the county, which is corrections, public defender, county attorneys, and then there's a clause in there for emergency. So the effort that the health department was doing in respects to trying to build the emergency contingency fund should not be hindered. How I interpret it, but it isn't there, so I'm thinking that effort to try to make sure that fund is built may still be able to be maintained just in case something happens like the rabies piece or anything to that degree. But the conversation's floating around for a while, but it's probably time to pick up that conversation about the foundation.
Yep.
And probably get it ready to present here and then probably to the big board, because I don't know what this will mean, but now if you're not a public safety entity, everybody else in the budget is feigning to stay under this gap. Yeah. And that gap is going to get continually squeezed just because of the demands on salaries and every other thing that can come. So right now it's at 0%. My understanding is there might be an effort. The speaker had committed to trying to, when the regular session gets back in January, to try to have that floor not at 0 but 3%. If that is to happen, that may be a little better, but I don't know where it is in the long term. And so hopefully the legislature switches over and you get a little more friendlier version that may be able to do that. But in release where that goes to health and how it may play out, and the councilman can comment on how that may interplay, because I don't know what that does in regards to other forces like planning that helps the health department carry out enforcement of ordinances or anything like that. But that is just something to be on everybody's mind, that is going to squeeze for a while until everybody can get a grip. Now you can go over, but I don't know how you practically function when you have to go to a vote of the people. So you would probably have to plan out a year and ahead about what you need and try to go. And if they say no, then you're at a point where you're going to have to make some hard decisions. So
And to that point, I am ready to present that when you are, so.
I would say tee it up next month.
All right.
Because we probably need to
You got it.
run forward and make the call, because it will, I just don't know what that does with grant funding and everything like that, but right now we need to be ready to free it up and go. I know there were conversations, there's two areas particularly that I know I mentioned. The public health piece and mental health piece was mentioned several times that did not get included. If this percentage thing doesn't happen in the legislature, I'm sure that move will continue to go. And then the other example that was brought up was probably technology, and I don't know if you can incorporate that in the different departments, because some of the technology demands that will continue to grow as things advance. So that's just to put on everybody's schedule and go from there.
You got it.
With that, I'll just mention, I mentioned at the beginning of the meeting, and kind of had a talk with Dr. Hughes and people that were here, that, just so you all aware, I'm gonna try to run the meetings a little tighter to get done by 9:45. I got a commitment at least now for to the rest of the year that's gonna require me on Wednesdays to be at a hard place at 10 o'clock. And so, probably not bad for the efficiency piece, but anything extra, I mean, to carry over, we can use on that administrative meeting. But hopefully the goal is to try to get the board meetings going on time and ready at 9:45. So with that, any questions from the board? Yeah, that's an administrative cut. There was proposed cuts on a lot of things in that budget. My understanding is some of the things that were in there, the DHS pieces are heavily administrative. So I don't know where that plays out, but I think if you read anything from that press conference yesterday, he couldn't get what he wanted, so this is gonna continue to get chopped at. So it's gonna be something we'll need to work out, watch out. Anybody else? Okay, with that, I don't have anything specifically. I do have some questions, but I'll reach out to you all for the reports. Some of it got answered anyway, but for the record, the next meeting will be September 8th. Any closing comments from the board? September 18th, sorry. Yes, ma'am. Okay. Oh, okay. We were able to work it out. So we will have first September first Friday in September, that the Administrative Health Committee meeting to further dive into some questions about the community health worker piece from the state. So board members are welcome to get on there. That will be by Zoom. With that, if there's nothing there, I'll entertain a motion to adjourn. Second. There's motion and second. Roll call.
Who motioned? I'm sorry.
I was a second.
Festerson and Weiss, sorry.
Okay. Okay. Wade?
Yes.
McNally?
Yes.
King? Festerson?
Yes.
Jones? Rogers?
Yes.
Espinoza? Wilkin?
Yes.
Weiss?
Thank you all.